Welcome to the Florida Plastic Surgery Group channel. I'm Dr. Michael Fallucco, board certified by the American Board of Plastic Surgery. Today we're going to talk about breast augmentation, and I want to go over some of the common questions that patients ask when we sit down during a consultation. The first question I ask is, what are your goals for surgery? Breast augmentation is meant to enhance the overall shape or volume of a breast with either implants or your own body's tissue through the process of liposuction, where we transfer unwanted areas of fat to the breast to increase the volume. Patients who've had pregnancy, breastfeeding, have lost a significant amount of weight, one of the concerns is breast augmentation all I need? And really that boils down to, is the nipple areola placed at the appropriate center of the implant? If not, we may combine a breast lift at the time of augmentation during the same surgery. The first question patients ask and we go over are the different type of implants. Implants come in two main types, saline versus silicone. Saline is filled with the same IV fluid used for hydration. Silicone is one of the longest studied devices in medical history, and it comes in various cross-linking, meaning how cohesive the implant is. From a more soft, smooth, round implant to a more fully cross-linked gummybear or shaped implant. Implants have two main surface qualities, either a smooth implant or a textured implant. The next thing we go over is, how do we place the implant? Where is the incision going to be? The most common incision used in the US in our practice is a small incision under the breast in an area known as the infirmary fold. Other options include the border of the areola or under the arm. The next question we go over is, where is the implant going to be placed in relation to the muscle? Most commonly we place the implant below the muscle. In certain patients, such as active bodybuilders, we may place the implant above the muscle. Another question related to the type of implant is, what is the profile of an implant? A profile of the implant relates to how wide or narrow the implant is and how much it projects off of the chest wall. The determining factor for the profile of the implant is the patient's desire for the size and the shape, as well as the overall measurements or width of the breast. The next question is, where will my surgery be performed? At Florida Plastic Surgery Group, all of our surgical procedures for breast augmentation are under the guidance of a board-certified anesthesiologist in an accredited surgery center setting. Patients will ask me, what is the day of surgery like? Usually surgery takes about an hour. We'll see you the week after. You'll be provided with all the support garments needed. You'll have a waterproof dressing over your incision. You can shower the next day. You can lift your arms above your head. You're not going to hurt anything. Typically, the implants will ride high after an implant, and it may take several weeks before the muscle accommodates and allows the implant to assume its final shape. Patients will ask, when can I resume full physical activity after surgery? Usually I don't want a patient to increase their heart rate 2 weeks after surgery. Then we'll guide you during the post-operative visits on what activity is allowed. Patients will ask, what is my scar going to look like after surgery? As a plastic surgeon, we pride ourselves on hiding scars and making them very fine and unnoticeable. As part of your breast augmentation, we will provide you with a specialized scar cream that'll help speed up that recovery and fading process. If you have any other topics that you'd like to discuss in addition to future educational topics we'll be covering, please let us know and we'll go from there.